Today I'm joined by Emily Sadri, who is going to talk about postpartum depression. Let me introduce her briefly before I bring her on. Emily Sadri is a holistic women's health nurse practitioner and nurse midwife with over a decade of experience working with women and families. She spent the last 5 years catching babies in a busy urban practice in Cleveland, Ohio, and recently left to open her own functional medicine for women practice. She is a yogi. She's also a mom of four, an avid cook, and is active in midwifery politics. She is passionate about bringing a whole body and whole mind approach to healthcare and to helping women overcome the obstacles that prevent them from serving their families, professions, and communities. So, hi, Emily. Thank you so much for joining me on this podcast interview.
Hi, thank you. Thank you so much for having me.
I'm so excited to talk to you. I just shared a little bit about your background and expertise with child and delivery. You've helped to deliver a lot of babies in your lifetime. And and you also have 4 kids of your own. Have you personally experienced postpartum depression, or have you helped other women deal with postpartum depression in your practice? And then also tell me a little bit about your practice and who you serve.
Sure. So thankfully, I personally have not experienced postpartum depression. We can get into later, all of the things that I did personally and what I, recommend to people in terms of, awareness, prevention, sort of ways to set yourself up to, decrease your chances of suffering from mental health issues during and after pregnancy. But I certainly have worked with lots of women. The incidence of postpartum depression is so high. It's so prevalent, and, just like mental illness is in the general population, it's the same, if not increased, around the time of pregnancy, so during pregnancy and after. Previously to having my own 4th baby 6 months ago, I was working in a full scope practice here in Cleveland, Ohio for the last 5 years, where I caught several hundred babies and took care of women prenatally and during their pregnancy and postpartum, as well as provided full scope gynecologic care. I left that practice in November and just opened a functional medicine for women practice here in Cleveland, taking care of, serving women who are interested in working a little bit deeper on their hormonal health issues, preconception. Postnatally, I do some lactation work, so supporting women with breastfeeding challenges, and coming at that from a really holistic perspective and a functional medicine perspective of like what may be going on deeper that is contributing to, poor supply, for example. If all of the things were done that should have, produced an adequate milk supply, but there's still an issue, sometimes we can dig a little deeper and find an answer.
Wow, that sounds so interesting. Just delivering babies and being a part of their whole process, because it can be so overwhelming being a new mom and not knowing what you're doing. I know for me, lactation alone was a challenge, so I can't imagine what some other people are going through.
Yeah, I mean, it's a time of huge transition, and something that's really interesting is that years ago, and back to thinking of our grandmothers and our grandmothers' grandmothers, we lived in a much more communal society, here and abroad, obviously. And we don't anymore. We live such isolated lives. We live distant from our mothers and our grandmothers and our sisters and our cousins. And so all of these events that are happening in women's lives that typically would happen with built-in support and built-in networks are not there anymore. And so that's certainly, being replaced in some regards by lots of great, networks for moms and, pre-pandemic. But it's not, you can't replace all of it. And one of the things that I think we miss out on the most is just seeing, birth, seeing the postpartum experience. We don't have a lot of hands-on or face-to-face experience with it until we go through it on our own. In our culture. And so that also can set women up for a lot of disappointment, for lack of a better word, but just not met expectations, because the media doesn't do a great job of portraying what is actually happening in that time period. And so it's often the case that women just aren't prepared for that time.
You're so right, in that a lot of us are disconnected and we don't have that raising other people's kids experience in a communal setting. And so it is a shock. And even for me, even though my cousins were having babies, I knew other people that had them. It's just, I was taken by surprise by the whole experience. So for people that don't really understand what postpartum depression is, can you explain some of the symptoms and what are some reasons that you think some women are getting postpartum depression?
Yeah, sure. So it's important, I think, to note and acknowledge that many women will feel a degree of mood change after giving birth, and a lot of that is within the normal range. So we typically call that postpartum blues, and that appears earlier, sort of around 3 to 7 to 10 days, depending, and that's typical. A lot of times that coincides with milk supply coming in and is usually transient. The way we differentiate that from postpartum depression is by severity of symptoms and pervasiveness, really. So hopelessness is a big sort of differentiator, like the lack of ability to see outside of, some mood changes in the perinatal and also postpartum period are normal and expected. We call, mild mood changes baby blues or postpartum blues, and those typically don't last for very long, a week or two. And then they should start to resolve. Oftentimes that starts around the time that milk is coming in, maybe as early as 3 days, but even up to 7 to 10 days later. And it typically resolves. It should be transient. And that's characterized by maybe being more emotional, being a little weepy. I usually tell people that, when your milk comes in, expect that as the milk flows, the tears will flow. That it's very normal to feel, as you have these massive hormonal shifts in the body, some big emotional changes as well. And I think on a sort of deeper, more spiritual level, that is intentional, and evolutionary, and that, our hearts are sort of really open in this postpartum period, and we're, and it's all facilitating bonding with the new baby. That hyper emotionality has a purpose in an ideal world. It's when that sort of goes too far that you have excessive symptoms, and that we get into the range of postpartum depression. So one of the differentiating aspects of postpartum depression is really not being able to take joy in your baby. Like, women will say, I love my baby. Like, I know that I love them, but I don't feel happy, looking at my baby in the way that I want to. Like, it feels sort of out of reach for me to have those happy, positive bonding feelings that I want. Hopelessness, symptoms similar to just major depressive disorder. Things like, fatigue is such a big part of the postpartum experience for almost every woman, because you're taking care of a new baby, and, it's a universal experience for the most part. But really feeling like that fatigue is so pervasive that you don't, not wanting to get out of bed, not wanting to socialize. Lack of appetite is a really big one. And oftentimes I find that women will present with only lack of appetite because they're so tired, and kind of the whole period is very confusing. But the one thing that sort of stands out that doesn't seem right is this lack of appetite, when in fact, especially if a woman's breastfeeding, her appetite should be increased. So that's something that I always look out for as well.
So there's a dangerous component to postpartum depression too. Can you talk a little bit about the extreme versions of postpartum depression? Because like you said, there's some people that might feel overwhelmed that this is a new baby and I just don't have the energy or even the desire to take care of it. But it can get pretty serious as well, right?
Yeah. So, much rarer. But postpartum psychosis is certainly a diagnosis that exists and that affects some women. That would include things like paranoia, thoughts of harming oneself or thoughts of harming one's baby. Sometimes people confuse that with some women who just have some postpartum depression or some postpartum anxiety or other mood disorder going on might have thoughts about something bad happening to their baby, or they can picture something bad happening to their baby, but they're not actually making a plan to do it. And I think those thoughts can scare women often, and they're afraid to talk about them, but it's really important to talk about them. And just because you have them doesn't mean that you have postpartum psychosis. Though there are warning signs with postpartum psychosis, and hopefully, if you're first feeling things like either crazy insomnia or obsessive thoughts, and or thoughts of harming oneself that don't go away and that you can't escape from and that you think you might even have a plan around, those are things or harming your baby that are really important to be recognized by people who are around women who are having babies, by providers in the medical field, and also just by, women themselves going into birth and delivery, especially if there's a history of mental illness in the family. Those women are at significantly higher risks for any kind of mood disorder in the postpartum period. And so ideally, if you have a provider who has knowledge around this, if there's a history in the family, these are things that have been talked about before the baby is even here, so that everyone is kind of in the loop and aware of, how a mom is doing.
Yeah, and that's my goal, is to really normalize this conversation, because
Mm-hmm.
having a baby takes its toll on women, and it is really difficult. It impacts the body, it impacts the mind. I mean, just the fact that our mind shrinks, or I mean, our brain shrinks during delivery and pregnancy, and it takes a while for everything to normalize. For women to know that this is difficult and to speak up and not feel like, well, I should know what to do, and I should not, I should love my baby, and I should be excited, and I should want to care for it, because sometimes, like you said, the amount of stress and the toll that it takes on a body can cause some of these issues.
Yeah. And I love the thing that struck me in your statement just now is the word should, right? Like, why do we come into these things with all of this shouldness of how things should be, right? Because whatever your experience is, that's what your experience is, right? And there's nothing wrong with your experience. It's just your experience. And if you're in struggle, that's part of your experience, and you deserve love and support, right? And help and care. And normalization from whether you're, provider or your family members or friends. And that is a tricky one. I think I have seen over the last decade a lot more normalization with perinatal mood disorders, and a lot more discussion. I think social media has helped with that. Women coming out and telling their stories. There's a lot of great organizations. POEM, POEM, is a great organization and resource, and they have support groups. I'm sure that most of them are virtual now, and all over the country, for women experiencing perinatal mood disorders and postpartum depression. So there is support out there for anyone who wants it and needs it. It's just about, finding it and, accepting that it's part of your experience, and that it's not something wrong, that it wasn't that something happened as it shouldn't have happened. It's just something that does happen.
Right. And I'm glad that social media is normalizing this issue. And a lot of celebrities are coming out and talking about it, which is normalizing it even more. I mean, even for me, I only have one child, but yet I did hear some people say, well, you're having a hard time over one child. People have 4 or 5 children and they are able to do it. And that made me feel like, well, it's my first child. I don't know what I'm doing. And so,
well, first of all, the first child is always the hardest.
Right.
I mean, that's a universal experience. So, poo on whoever said that to you, because, I mean, how could it not be? It's the first time that you're doing something that's really, really hard, and the same goes for birth. I mean, usually the first birth is the hardest. And then again, you bring up another really important point, which is that people always have a lot of things to say, and they're not always the most helpful.
Right. But it's like I said, mentally and here, cognitively, I know that was not the right thing for me to be ashamed of. It's my first child. I don't know what I'm doing. It's really overwhelming. But emotionally, you kind of internalize that, like I should know what I'm doing, or I should be a better mom, or I should. And there's so many judgments and criticisms from other moms, and ill-advised, unnecessary, just the advice from people that can really make it difficult for some moms. Have you experienced that, or with the people that you work with, and how do you help them with that?
Yeah, I think that, mom guilt and shame is a real thing, and something that's pretty universal among women, feeling like I should be better. I should do this. I think that especially with so many women balancing professional careers and motherhood, there's this constant expectation that we put on ourselves to achieve, greatness in the home, greatness with motherhood, and greatness in our profession, be a great peer, be a great daughter, be a great friend, and you can't you just can't do all those things all the time for everyone. And so helping women to really prioritize, what in this time period do you want to focus on doing well, and what is not as important and what can be let go. And then additionally, who are your trusted people? Who can you confide in, and who do you know even before you give birth are the people that you can trust to share with, who will support you if you're in struggle. And keeping that circle tight, because I think that we get disappointed if we share with a person who maybe isn't equipped to be that support person. Like maybe, your sister-in-law is not a great person, just for an example, and that's not the person that you want to share with, because you're going to set yourself up for disappointment. And sometimes you need to identify those people as a mental health professional or a postpartum doula, which is a great way to get yourself some built-in, skilled support with people who are used to being around women postpartum, who are used to, helping women care for their babies and understand, what is needed in the postpartum period to really support a woman's physical and mental health.
It's so important to surround yourself with people that are supportive. And like you said, it might not be your family members. It might not be the people that you're closest with. So for me, one of the most supportive people that came out of nowhere was my acupuncturist. I mean, right after I gave birth, she came with this huge pot of bone broth that I didn't even know I needed, but I needed. And so just the support that she gave me, checking in on me and making sure I was okay and getting the right nutrients. It could be like I said, it could be anybody that's outside of you, and maybe you can surround yourself by those people. And it could be professionals that you might be paying to do that, and that's okay too. So besides all of that and making sure you have a healthy support system, how else can people overcome postpartum depression? And then you were going to talk about prevention as well.
Well, I think we could start by saying that one thing that I really encourage women to do early on in pregnancy is to come up with a postpartum plan. And so I think that can be largely, it's hard I don't want to go out and say it's preventive, because there are so many factors that make someone susceptible to having postpartum depression. What was going on in the pregnancy, what's going on physiologically or, pathophysiologically in the body. But so these are things that it's not like there's great studies showing that if you hire a postpartum doula, you'll have less postpartum depression. However, I do think that having a good postpartum plan can help set you up for success in the postpartum period. And if you do experience mental health problems in the postpartum period, you already set up and you already have your resources and everything in place. So I'm just going to preface it with that, because I don't want to give people the impression that you can, not have postpartum depression if you hire a doula or something like that. But I like to tell people, think about, what you're going to need. And one of the most important things is who's going to be, if you have other children, who's going to be helping with your other children, who's going to be taking on some of the tasks of everyday life that need to happen for your household or your finances or whatever to run. If people have someone like a mother or a mother-in-law or an aunt who either lives nearby or can come and stay with them, I really encourage people to do that if that's a relationship that's positive in their lives. For myself, my mother-in-law is Iranian and had lots of traditions around the postpartum period, and came and stayed with me for 3 to 4 weeks after every baby and cooked foods for me and helped with the other kids, and just allowed me to really take a rest period. And so if you can identify someone and you're lucky enough to have that person in your life, and I realize not everyone does, but if you do, utilize them. You often will be surprised how grateful you are for that help. And we have really lost that tradition in the US of doing nothing for the first however many days. In many cultures, it's 28 days or 40 days. And it's a period of lying in, of really not exerting yourself physically beyond, moving about the house simply. It's a period where you're not going out into public. So I think that alleviate stress in a few ways. One is that, it's just physically, you shouldn't be kind of lugging around a car seat or a baby and going out into public. Don't want to be exposing yourself to potential infections or, just challenging your immune system anymore. And then I think there's an aspect, a social emotional aspect of, it's hard when you're 2 or 3 weeks postpartum to go to Whole Foods and have a conversation with someone. It gets a lot of emotional output. Then we really need to reserve all that energy for ourselves and our baby during that time. So people are often shocked when I say that because, you have this image of Princess Kate, of course, how could I forget, taking beautiful pictures and looking so put together the day after childbirth. And, she has a team of people that are helping her pull that off, but it's just not a realistic representation of what you can really expect of yourself. And when we lower the expectations, and if you expect that for the first 2 to 4 weeks, ideally, I like to tell people that 30 to 40 day period, try to take everything off of your plate. Try to make your only job feeding your baby and caring for yourself and your body. So even limiting visitors, like not having visitors for more than 30 to 60 minutes a day, because that's exhausting and tiring, right? And most of those visitors don't really remember or know what's going on in this very precious time, and don't understand like the energetic output that's happening in terms of recovery from birth and all of what's going on for your uterus to recover, your body to recover, for your body to make milk, and then for you just to have the energy to be feeding a baby around the clock, including overnight. So having a postpartum plan is so huge and crucial. So the support aspect, the taking tasks off of your plate, and then having some plans around food. What are you going to eat? How is it going to get prepared? Those are the first things that I talk about with women when they're concerned about postpartum depression.
Well, like you said, there's so much pressure now with social media. I mean, there's the positive side of social media and that it's normalizing the concept of postpartum. But then, like you said, there are people like Princess Kate or celebrities that bounce back, or they look perfect. They have a hair and makeup team come in and do their hair and makeup so they can post it on social media. Mm-hmm. And there are people that end up having plastic surgery. I mean, let's be honest about that. A lot of those people are not bouncing back a month after and doing a Victoria's Secret fashion show naturally. They are definitely having some kind of work done. But the rest of us are watching that, and it's like we feel the pressure, like we have to bounce back and we have to stop eating because we have gained all this weight. So all of that can contribute to beating ourselves up, to feeling that pressure, to feeling like we have to start working. I mean, I did not work out at all for the first 6 months because I was breastfeeding and I didn't want all those toxins to be released from my fat into the milk. And so a lot of people, though, they're so focused on bouncing back and getting back in shape.
The other interesting thing is that when you're exercising, especially anything really high intensity, and you have dopamine release in the brain, that's a suppressant for prolactin. So a lot of women will notice a decrease in milk supply if they start to do anything high intensity or with like prolonged periods of cardio. When it's a positive thing when you're exercising outside of that time because you get that dopamine rush and you feel really good. But it does suppress prolactin. So it can, especially if someone is struggling with milk supply, particularly a person who's gone back to work and has physical separation from their infant, which is a reality for so many women because we have such terrible maternity leave policies in this country. But it's just something to think about, that I usually encourage women to start with something like yoga, something that feels good and helps their joints to get some mobility and circulation, and really is countering all of this posturing that we do with a new baby that's our shoulders are hunched, our lower back is sort of cramped, we're tilting to one side as we're holding a baby on one side of our body. So that's really can be very uncomfortable. I do recommend movement, but yeah, that high intensity exercise that lots of people love to do is not necessarily appropriate for the first several months postpartum.
I like the idea of yoga, and that I was doing a lot of yoga just to stretch and be flexible. But like I said, a lot of people aren't focused on that. They're focused on weight loss. And so that can add to the pressure.
Well, if you've ever been to a dairy farm and you've seen the milk cows, they don't exercise them. Like the milk cows lie around all day on the hay, and they purposely like feed them enough and kind of pamper them. and allow them to just rest and really be in this like parasympathetic state. So they don't want to stress out the cows because they know that's going to decrease their milk supply. And so farmers know this about cattle in terms of producing good milk for sales purposes and, to have abundant profit, but we don't really talk about these things as much with women. We kind of just expect if your supply has gone down, one of the most effective things, to improve that is just contact with your baby, extra pumping, which all works. But if some of the underlying things aren't there, if you're in a constant state of stress, and you're rushing off to work and you're pumping in the car, sometimes there's only so much that we can do because we can't erase cortisol, with a pump.
Right. It is a lot of stress. And like you said, the maternity system the leave is terrible here. And a lot of women don't get to enjoy that bonding period because they have to get back to work. You were very lucky to have your mother-in-law stay with you. That's also part of our culture. The first 40 days is very much a time of rest and just taking care of yourself. And I hope that most people will adopt that and really pamper the mom because she's going through so many changes.
Mm-hmm. Yeah. And there's in major cities like in LA and in New York now, I know that you can hire certain services that specifically make nutrition for postpartum women. So they'll come and bring you food for the first, you can sign up a week by week meal, but however many meals. And I think that that's wonderful if you have the resources to do something like that and you don't have, a tradition or a person who can come and do that for you. And meal trains are wonderful too, because, to have friends and family, sign up to bring you things. I think people do want to help after baby's born. I think the tricky thing with that is that sometimes you're afraid as a new mom to maybe ask for what you need meal wise. But it is important, to be eating really nourishing foods. I often recommend anything that's warm and cooked. The nutrients are more easily assimilated, and the bowels are undergoing a massive shift postpartum because all this pressure is gone from the abdomen, because you used to have a huge uterus filled with baby there, and now that's gone. And so some of the bowel motility can be a little bit of an issue, and so we really want to not fill up with sort of cold and hard and things that take a lot of digestive energy to digest and assimilate nutrients, like lots of raw veggies and things that you would typically think of as healthy but quick are not necessarily the best things to be eating postpartum. So I tell people, if you have to order takeout, get Indian food, get something that's really cooked with lots of vegetables, lots of fiber, lots of easy to assimilate nutrients. Broths are great. And most Eastern cultures have some kind of traditional postpartum soup. I'm sure that you have something maybe that you had when you had your children, and my mother-in-law always made me shank, lamb shank, and things with lots of, cooked greens. So stuff that's really high in iron, that's really replenishing and nourishing for the system.
Yeah, I mean, we have fenugreek is a spice that we add to our spinach and make the spinach dishes, and there are soups that we eat because it really helps with milk production. And there are, like you said, really healthy meals. And I hope that a lot of new moms are not resorting to fast food and just processed food because you're not feeding and providing nutrients to that baby. But speaking of foods and for me, not only was the food really important. I mean, I had my mom cooking for me, which was really good, but also supplements. I mean, I was very religious about my food, my vitamins, and my, like I said, the teas, the fenugreek tea and different supplements. Are there some supplements that you would recommend that people that are, whether they have postpartum depression or not, just to kind of help them stay healthy after post-delivery, that you can recommend?
Yeah, I mean, I think it's really similar to what's going on in pregnancy. So, depending on your individual and unique needs and health history, it's, if you're interested in really knowing what kind of, nutraceuticals would be serving you, I think it's important to consult with a functional medicine dietitian or provider. That being said, things that are pretty common across the board that are needed, that I usually recommend for pregnancy and then to continue into the postpartum period would be a high quality prenatal that has methylfolate in it, which is, a lot of prenatal vitamins will have folic acid, which is not readily usable by many people's bodies. So high quality prenatal, and then an omega So an EPA DHA supplement has been shown in numerous studies to improve brain development, fine motor skills, and things like that in offspring. So I think that's really important, especially when we're telling pregnant women to avoid too many fish servings a day because of toxins in fish. So that's one that I recommend pretty across the board in pregnancy. In terms of postpartum, I don't right off the bat recommend herbs for boosting milk supply, because for many women that's going to create an oversupply, which can be just as much of an issue, not only for a mom in terms of discomfort, but also for a baby, in terms of making feeds comfortable and making it easy for a baby to suck and swallow and digest, and it can contribute to some issues. So unless there's a diagnosed low supply issue, I don't recommend the guzzling, cups of mother's milk tea. Herbs that are really nice for the postpartum period are things like ginger. Ginger is great for milk supply, but also great for just as a warming herb in the whole body, and helps with digestion, and it's just a lovely one for postpartum. Things to avoid would be like a lot of the, like I say, like Thanksgiving herbs, like high amounts of like sage, rosemary, thyme. Those things are all, antimicrobial, and they're great in that respect, but they can be kind of astringent. And so they can decrease milk supply, as well as things like antihistamines. So if you're someone who has seasonal allergies and you will reach for a Benadryl or Claritin or things on occasion, over time that can impact milk supply. So it's not a great one to reach for. And then, aside from that, other supplements in terms of postpartum depression, if you have a history of depression, we know that, methylfolate and that B vitamins play a large role in depression. Having an adequate vitamin D level is really important. Low vitamin D has been associated with clinical depression. And so those are really the basic ones, and the fish oil, like a DHA EPA combo.
I think it's so important to talk to, like you said, not a mental health professional, but to talk to integrative medical professional, your own doctor, your OBGYN. I mean, for me personally, I did struggle with milk supply, and so the fenugreek really did help, and mother's milk was recommended to me. Iron was another thing that I really needed. I was very deficient in iron. I mean, I've always been borderline anemic. And
Right.
so buying the right iron, not the just I bought the liquid one. I forget what the name of it was, but that really was a huge help for me in helping.
Floridex.
Yes. Mm-hmm. Floridex, right?
Yep.
It's in that red and white container. So to look for that. But that was really important for me to take my iron supplement. And I continued to breastfeed for 20 months. So it was really important for me to maintain my milk supply, because I knew it was really good for my daughter. I knew it was good for her development. And so as much as I didn't like the whole process, I just wanted, I ate to make sure that she was getting the nutrients. And so I avoided caffeine. So what are your thoughts about people that are drinking coffee and caffeine as they're breastfeeding?
Yeah, I mean, I think everyone's going to be different, but studies do show that excessive caffeine intake can affect babies. It might make them, shorten their sleep duration, make them a little bit more fussy. It takes about 12 hours to metabolize caffeine once we take it in. So 1 cup in the morning may not, affect overnight sleep for a baby, but it really depends on everybody. Some people are like high metabolizers of caffeine. Some people are slow metabolizers of caffeine. So if you're someone who enjoys 1 cup a day and you don't want to break that routine, I don't think you have to force yourself to stop it. I think where we get into a problem is women who we're asking too much of and who are going back to work at 3 months or sooner, and they're exhausted. And they're pumping and they're up at night, with a baby. And so they're depending on caffeine to stay awake during the day. And that, creates several problems. The first would be hydration, and that caffeine is just dehydrating. So you have to be super hydrated in order to make milk, because you're literally pulling fluid out of your body, right? So you have higher fluid needs. Second, is that it wreaks havoc on your hormones to be depending on caffeine all day long. And so it really, kind of messes with your cortisol, which just further messes up your energy levels. And so that women will often just start to feel so tired and wired, like that exhaustion and anxiety married together, which is just a recipe for disaster, I think, in terms of like mental health in that first year postpartum. Because I think women really beat themselves up when they're cranky and they're snappy at their kids. And we can help that, right? I mean, and it's not, and a lot of that sure is support and feeling, you know, a sense of love and belonging and supported and like not feeling all these bad, you know, emotions that can contribute to that. But some of that is your physical health. And sometimes even if you can't, especially if you can't explain, like I have a great relationship with my partner, I have good support, but I just feel like quick to anger, quick to frustrate. I have unexplained anxiety. A lot of times that's because you've just drained out your cortisol in that first year from having bad sleep patterns and then using caffeine to fix it, which just further tires your adrenals, because when you drink caffeine, you get a little cortisol spike from your adrenals, and eventually it's not like a forever giving tank. That tank gets empty. And so you get drained out there. So I don't know if I answered your question, but I think that's a big issue. I think we really like, everywhere moms are like, oh, starting my day with my cup of coffee, and it's like a 20-ounce, you know, cup of coffee, and it can be really problematic. So I recommend to women, like, try to find something else that kind of keeps your energy level sustained. Like low carb diets, I do not recommend in the first year postpartum for anyone, because that is also really tiring on your cortisol. And we do derive energy, especially when we're converting that energy rapidly into nutrition for our babies from carbohydrates. So we don't want to create a starvation, you know, response or effect in our bodies when we're nursing. And so I do recommend each meal and each snack should really have some carb, some protein, some fat. Like we really shouldn't be carb restricting, choosing complex carbs for sure. You know, whole grains, complex carbs, you know, avoiding dietary irritants if you know that something doesn't sit well with your system, for sure. But yeah, to eat consistently and to eat really whole foods that break down slowly so that you can maintain your energy despite the fact that, you know, your body is really working hard to sustain your energy and to produce milk.
Oh, yeah. I mean, there's so much going on. We need to honor our body. One thing, I was going through graduate school while I had a little baby and writing my dissertation. And so not only was I up with her, feeding her, but I was also up writing my dissertation. And so for me, it was so important to manage my stress level, to take care of myself. I am so grateful for my acupuncturist who I would see regularly. I would go to chiropractic treatments because, like you said, your shoulders are hunched over, and I ended up having severe back pain from that. Getting massages regularly, those are all really important. Are there some holistic interventions that you recommend besides all of that for moms going through either postpartum depression or just postpartum in general?
Yeah. So you mentioned acupuncture, and actually one of my favorite things that was introduced to me by someone who practices acupuncture and Chinese medicine years ago after my second baby was using moxa sticks, which is mugwort herb, essentially. And people might be familiar with that because it's an herb that we use to encourage a baby to turn if they're presenting in the not optimal position. So either breech, or if they're kind of cockeyed in the uterus and not coming down with their head in a nicely flexed position. And so we use that, and we burn it by the pinky toe in order to get the uterus sort of to churn up energy in the uterus, is how I like to think of it, that sort of encourages the baby to move. Well, it also serves a purpose postpartum. It really is an herb that has an affinity for the uterus, and the uterus is in a phase of rapid healing, and involution is the process of the uterus, you know, going from that large, stretched out, swollen, you know, position to going all the way back down to its normal size. And so taking a little mugwort, they make a thing called a moxa box, and you can even get it on Amazon, I think. And you stick this sort of smokeless moxa, you light it, and you place the moxa box. You can place it either low on your abdomen, or you can lay on your belly and place it on your sacrum. And it just has this very warm, calming effect to the uterus. My experience of it was just, it almost felt like a soft heating pad, like, but on the inside of your body, you know, just in the way that it kind of toned and relaxed the uterine muscles and ligaments. So I think that that's just a nice, like, affordable, you know, self-care thing, a ritual, a moment where you can take time to lie down and breathe, do some mindfulness, you know, send some healing energy into your own body and kind of refocus and recalibrate a little bit. So that would be one thing that I would recommend. The second that I love and that I prescribe to women all the time postpartum, especially those who are feeling kind of tired and wired and fried and maybe having some symptoms of anxiety, and we don't feel like they have clinical depression yet. They're not in that postpartum depression space, or maybe maybe they are having some postpartum depression and they want to try some natural methods before going to a medication. And so one thing that, besides talk therapy and all of those sort of psychosocial interventions, which we certainly talk about, I often will recommend doing Epsom salt baths, which is a really cheap and easy intervention. And you just, ask someone to hold your baby for a half an hour. Use 2 full cups of Epsom salt, and try to, be careful of the ones at CVS and different stores that have like tons of fragrances in them. I think they're too much and they can be irritating, especially if your perineum is still healing. And so 2 full cups of Epsom salt in your bath and soak in there for at least a half an hour. And then when you come out, don't rinse off with shower water. So let that magnesium really soak into the skin. Magnesium is like the great relaxant mineral. And, it sort of relaxes and fills up the muscles nicely. And it also has a nice neurologic calming effect. So that can help promote some deeper, more restful sleep and soothe some symptoms of mild anxiety.
And I love that it detoxes you at the same time while you're using it. So yeah, Epsom salt baths are really good. They're relaxing, they're calming, and if you can't get out to go get massage, especially with COVID, you might not be able to get the massages. There's also those acupuncture mats that you can get on Amazon. It has a little pillow. They're like these little spikes that you lay on, and then the pillow has little spikes as well. I found that even to this day, I use it. It's a really nice, relaxing little mat to lay on while you're doing a 10 to 15 minute guided meditation, just to kind of recharge yourself.
Yeah. And I tell people, save your money on like the big expensive baby things, and, invest in yourself postpartum, budget if you can, for as much self-care as possible, because it really will pay off in the long run. And I find that a lot of women struggle, the most at 9 months or 12 months, because they've just kept pushing so hard through that first year. And it's like, at that point they start to crash and burn a little bit. And so treat yourself as if you're postpartum for that whole first year, or as long as you need to, by doing those things to kind of refill your tank, settle your nervous system, induce a parasympathetic response, to promote some deep healing. And remember that it took 9 months to become fully pregnant and deliver a baby, birth a baby. It takes at least 9 months to get back to the other side. And anything in the body, whether you're detoxing or you're doing an elimination diet or you're restoring your gut health or whatever, it takes time, right? These things do not happen overnight, and they're best when they happen over time, because then it's not a shock to the body, right? And we're really trying to decrease that stress response whenever we're making great changes in the body, because the body doesn't like that, right? And often that just proliferates the problem we're trying to fix.
Well, one of the advice that my professors would give me, because when I was still in graduate school and I was like, oh yeah, I'm going to have this baby and I'm going to finish the class and I'm going to finish my dissertation and I'm just going to go, 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 go. And they're like, your brain isn't going to be back to normal until 6 months, at least 6 months after you have your baby. And that was so true, because the next semester I ended up taking all these classes, and it did take me a while before I could function at the same level. And a lot of these women, they are going through a lot of changes. And if you have other kids, there's a lot of stress on the body. So self-care. And I love what you said about investing in your self-care instead of all these unnecessary things we buy for the baby. I wasted so much money on buying things that we never even used and then just gave away. So
yeah, buy things used, buy it on Craigslist, like borrow it from a friend. Wait until the baby comes before you buy more of like one of anything. Like, don't buy multiple swaddles and multiple blankets, and just find what you like and what works for you, and then have the minimal that you need. You're going to be doing laundry almost every day anyways. So it's better to just keep it really, really, really simple in terms of all that stuff, and instead invest in the things that are going to actually carry you through that first year.
self-care, invest in that self-care. I totally agree with that.
Yeah.
So knowing what you know now about childbirth and delivery, what would you say to your younger self, even as a young mom with your first child? What would you say to yourself? What advice would you give?
I mean, so many things, so many things. So as a side note, and I'll get back to that, one thing that is sort of a particular passion of mine, and because of my first child, is babies that have food intolerances when they're nursing. And so my first baby had severe colic and digestive issues when I was breastfeeding her. And it took me going to several practitioners and doing a ton of research and really finding experts in the field for me to identify, what was bothering her and what was triggering her, and to know, I knew that it was coming from my diet, even though some pediatricians denied that. And I continued and persevered, and, she breastfed until she was almost 3 years old. And one of the things that I really learned through that period of time was the connection with maternal gut health and infant food sensitivities. And so and that's something that there's not a ton of like great solid scientific research on this, but there really is a correlation between, what sort of circulating proteins are in the maternal bloodstream from components of their food and what is a baby maybe responding to, because ideally breast milk is pre-digested food. It's food where all those, proteins that could be triggering an immune response are broken down, so that because the baby's immune system is underdeveloped. So if you have poor digestion, or if you have leaky gut as a nursing mother, that can contribute to or worsen symptoms of digestive distress, colic, eczema, things like that in infants. I always tell women that there is hope around that we can, start with an elimination diet. You can also speak to a functional practitioner and find ways to improve digestion, even in the short term, and, eliminate offending foods and really make that so that you can be successful there. Because I think many women feel like their only option is to put their baby on hypoallergenic formulas. And although sometimes that is where you might end up, because every situation is different. And certainly there are some conditions that we can't, sometimes we just can't get around that. And a fed baby is best, 100%. We can't have a baby starving. And mental health, right? We need to preserve the mother's mental health. So there's always going to be a different care plan depending on how we meet all of those needs. But that is a real thing, food intolerances through the breast milk. And so sometimes that's a window of opportunity for a woman to learn about herself and to learn about, what areas of her health she can work on and where she can focus, when she's ready to.
Well, thank you for all that information. Where can people find you and continue this conversation with you and chat with you if they need to?
Yeah. So I am on Instagram, my new baby, brand new practice. It's at Holistic Women's, WOMENSCLE, which is short for Cleveland. So Holistic Women's Cle is my IG handle. And our website's pending. Will be where I see women virtually for now from Ohio and Pennsylvania.
Well, hopefully through social media, they can find your website as well.
Yeah, absolutely.
Thank you so much for this conversation. I think a lot of women need to be reminded of self-care and doing things to make the whole delivery process easier, and then enjoy their process, just bonding with their babies.
Absolutely. Thank you so much for having this conversation with me and sharing this good information.